My name is Jami Taylor. I'm Senior Director of Global Public Health Systems, Policy and Partnerships. Now this is a new title, and I'll talk a little bit about some of the new titles in a new organization at Johnson & Johnson, focused on global public health, but this word systems I think is a really important inclusion in the work that we're doing, and it certainly speaks to stretching boundaries, stretching our own boundaries as an organization, as we've mentioned. First, I'll say it's a huge honor to be here. My congratulations to the organizers for centering today's meeting on, I think, a very important, relevant, and timely theme, that of realizing the multidisciplinary post-2015 development agenda. So as I just mentioned, today I'll describe how Johnson & Johnson is organizing differently around this multidisciplinary approach here at the dawn of the SDGs era. It goes without saying, perhaps, that Johnson & Johnson is very committed to delivering a holistic approach to chronic challenges like NTDs, and including, of course, the innovation of critical medicines in this space, and I'll speak more about that in a few moments. But we're doing more than just driving forward R&D. In fact, we're forming new cross-sector partnerships with governments and community-based organizations. We're working more on the ground to enhance access to medicines and other services that support poverty reduction and good health, and we are stretching ourselves in new ways, as I've mentioned. We believe it's this holistic approach to tackling NTDs, NTD coinfections, and other comorbidities that is really the key to progress. So here's our global public health aspiration, and I won't read through it all, but suffice it to say that there's a very high aspiration bound up in this text. As one of the world's most broadly based healthcare organizations, the Johnson & Johnson family of companies aspires to make a lasting difference in human health by addressing comprehensive health needs and delivering meaningful and enduring impact. That enduring impact piece is often the most difficult, especially as we come to challenging neglected tropical diseases like soil-transmitted helminthiasis, as we'll discuss shortly. Now, while the international community has made significant progress in meeting critical health challenges, we believe that there is increased urgency, and it must be a new call for holistic solutions that demonstrate this enduring impact. Solutions for the long term that can help to serve those at-risk and vulnerable communities at large. Addressing these gaps, inefficiencies, lack of critical resources within health systems and resource-limited settings is key to this end. So just 3 weeks ago, Johnson & Johnson announced a new global public health organization, drawing upon our legacy and philanthropy through worldwide corporate contributions, the incredible body of work within Janssen, our pharmaceutical companies, across HIV, TB, STH, and other areas, and then stretching more broadly to encompass our medical device sector, exploring areas like basic surgery and access to those important services, and then interestingly stretching into our consumer product sector, many of the products that you might be very familiar with, Rock, Neutrogena, Clean and Clear, Listerine, and so forth. On its face, it might seem that our consumer sector, for example, might have little to contribute to the global public health equation, but as we've started to dig there, as we've seen the huge amount of talent interested in global public health and contributing, what we found is that there's a treasure trove of skills that can be brought to bear specifically to the global public health space and even to NTDs. Behavior change, for example, education, simple consumer, what we might call in our consumer sector, consumer insights, bringing those insights forward and applying them to the global public space has already proven to be transformative, we believe, and we look forward to applying those skills and insights, again, from across the breadth of our enterprise to NTDs in particular. Now, of course, we recognize that solving today's persistent public health challenges like NTDs and co-infections requires new innovative ways of thinking that are grounded in sustainability. It's part of why we've organized so strongly in this space. As we seek out that enduring impact, we need enduring organizational structure that can service that need for impact. We believe that collaboration within our organization and beyond is the key to real and lasting progress. So how are we collaborating? How are we working to fill these gaps, inefficiencies, and so forth? I've mentioned our R&D portfolio. We're very proud of it. Our Janssen Pharmaceutical Company scientists are working around the clock to develop transformational medical innovations against NTDs and co-infections. We have a robust portfolio, as I've mentioned, in HIV, in multi-drug resistant tuberculosis, among other pipeline products well under development. As part of our 2012 London Declaration Pledge, we committed a preclinical research and clinical development program in flubendazole, a potential new treatment against filariasis. We also committed to developing a new chewable formulation of mebendazole, here again drawing upon our consumer products and know-how, products very familiar to you, like chewable formulations of Tylenol, for example. So drawing upon that formulation innovation to be able to treat intestinal worms, STH, in younger children. We recently completed our phase 3 clinical trial of this potential medicine at study sites in Ethiopia and Rwanda, and we're very pleased with the outcomes there. To ensure access to mebendazole, we're donating up to 200 million doses of medicine each year to over 20 countries, and we're continuing to expand on that commitment through Children Without Worms through at least the year 2020. We're very proud of these accomplishments. We are very proud of these commitments, but we know, of course, that therapeutics are not enough. Technology itself is not enough, and many promising technologies and programs for NTDs cannot advance without an enabling policy environment. So 2 years ago, we established the Janssen Neglected Diseases Policy Task Force to look at those gaps, to look at challenges like lack of investment, government investment in basic research, for example, to help drive new institutes for learning and for awareness at the public sector level. We've engaged very heavily in the US and in other jurisdictions, testifying before Congress and helping to organize congressional hearings on these neglected areas. And we've already seen, I think, important traction using our heft as an organization to elevate these issues forward. So I mentioned this importance of collaboration and this engagement of public sector. Some of that's now come together in an exciting new initiative, which I'll describe now. So in February 2015, as part of the activities of our Janssen Neglected Diseases Policy Task Force, we met with then Minister of International Development in Canada, Minister Christian Paradis, and we described to him our London Declaration commitments, as I've just described to you now, but also described the limitations, as I've also mentioned. The fact is that despite all of our efforts around mass drug administration to help control soil-transmitted helminthiasis, as many of you are well aware, often the impact of those interventions is limited, fleeting sometimes because of high rates of reinfection. There are many factors that contribute to reinfection that are simply outside the control of a mass drug administration program, and we were looking to Minister Paradis to help us from his bird's eye view as a major player in government to connect the dots with other players in WASH, for example, in nutrition, and help us to really begin to pursue an integrated development platform for the prevention and control of soil-transmitted helminthiasis. Minister Paradis embraced the idea and had many ideas for us as far as how we might be able to combine our efforts with organizations already receiving support from the Canadian government to reduce poverty, to reduce other areas of disease and ill health. So just shortly after that meeting, Minister Paradis connected us with a number of players, as I've mentioned, to attack especially STH in Bangladesh. And Bangladesh is a priority country for Canada and I think many other donor governments around the world, given the extent of the need there across a range of areas. Canada has used this term blended finance, blended knowledge, blended partnerships, and I think the idea of blending is very important as we think about the lexicon for the SDGs era. And we at Johnson & Johnson are really kind of pioneering this blending toward this new level of collaboration. So how are we doing that? Well, we're collecting many partners around a single vision. Here, as you can see, a shared vision of a world in which women are healthy and children can reach their full potential. This is a vision, in fact, set by our government partner, and our government partner is leading the charge in coalescing partners around it. You see the Government of Canada listed here. One of its primary partners in nutrition, the Micronutrient Initiative, has now come on board formally to form what we're informally calling the DAWN Initiative, standing for deworming adolescents, certainly a population cohort that we've needed to expand into for mass drug administration programs and has arguably been neglected chronically in terms of specific health needs there. So deworming adolescents, WASH, a critical component to STH prevention and control, and then nutrition. So the initiative will begin in Bangladesh, where over the next 5 years we will aim to reduce STH infections, promote healthy behavior change for long-term prevention, and support affected populations with critical nutrition, education, and other services. Our intent is to later expand this initiative beyond Bangladesh to help additional communities build the foundation of lasting health. So our team just returned from Bangladesh, and I wanted to share just one story with you. This was one of several trips that have been taken as part of this blended partnerships approach with an eye to connecting the dots with on-the-ground implementing partners, with WASH partners, nutrition partners, and others there who are implementing historic services that have historically been disparate but now are layering together toward this new model of, again, integrated development. So we had all of these partners in the room with many young children who are participating in a newer program called Little Doctors. Some of you may have heard of this before. It's a program we're very proud to sponsor at Johnson & Johnson. What it is a peer mentoring program for young elementary school-aged children, primary school-aged children, to mentor those who are in school and those who do not have access to school services in their communities, to share with them important hygiene practices, etc., in support of STH control and prevention. So in the course of meeting with these young little doctors, our team facilitated a conversation, and part of that conversation entailed discussion about aspirations that they as a group had collectively and individually. And one of my colleagues said, how many of you want to be a doctor when you grow up? And about 80% of these young children raised their hands. And to the other 20%, he asked them what they might like to be. And one said, I would like to be an engineer. He said, well, that's great. We certainly need engineers in the world. One said, I'd like to be an artist. And we said, of course, the world definitely needs artists. And then one said, well, I would like to be a singer when I grow up. And so through the interpreter, our interpreter asked that this young boy stand up and give us a rendition of a favorite song. And he stood up and began to sing, We Shall Overcome, in the spirit of the meeting, which was overcoming soil-transmitted helminthiasis, of course, this persistent infection that's really plagued their local community. And the whole room joined in song, We Shall Overcome. It was a very, very powerful moment for our team and certainly reminded us why we do this work. And I think it was inspiring for all of our partners. Indeed, we shall overcome these challenges of NTDs in these communities only through these, we believe, through collaboration, through this blending. And so based on the hypothesis of many partners in one vision, we are driving this new level of collaboration in global public health. It is this vision, a vision of overcoming poor health, NTDs, comorbidities, and all of those factors that contribute to poverty. We are working hard to create innovative, sustainable healthcare solutions, whether it be through the medicines we develop, through the collaborations we forge, or through the initiatives that we champion. Everything we do is based on our desire to empower families and communities to create healthier futures, and our commitment to this remains unshaken and is strengthened every time we spend time in the field, as we did just a few weeks ago in Bangladesh. We are fully convinced that in order to achieve this vision, we must link arms with others similarly committed, but diverse in our areas of expertise. We must reach out to those from across disciplines and roll up our sleeves together in coordination to drive that enduring impact and to reach our shared goals. So thank you again for inviting me to speak today. I believe we have so much to learn from each other, and it's forums like this that allow us to have those diverse, multidisciplinary conversations. And I should tell you that at J&J, despite our long history in soil-transmitted helminthiasis in particular, despite our legacy there and the commitments that we're so proud of, we believe that we're still very much at the beginning stage of this journey, especially as we've begun to organize it. So I would ask all of you to embark on this journey with us, to advise us, to guide us, and to hold us accountable. And I hope that I'll be able to come back at some future point and report on our progress. And I hope that all of you can be a part of helping us to achieve this progress, again, for that sustainable, enduring impact. Thank you.